Hi, virtual AAPOR. It's great to see you all remotely. I'm Claudia Deane. I'm the Vice President of Research at the Pew Research Center, and I've been an AAPOR member for north of 2 decades at this point, and happy to be so. Like all of you, at the center, our personal and our professional lives were turned somewhat upside down by this international pandemic. The silver lining for me and for many others I work with is that the tools that we've spent so long perfecting are extremely useful right now in trying to explain to policymakers and others that are reacting in the moment what publics are thinking, feeling, worrying about, and like. In terms of the way we're reacting to this at the center, we are, of course, thinking about this as a breaking news crisis and attempting to shed light right now. But we also want to focus on the fact that this is going to be a long-term story about crisis and then about recovery, and that many of the themes and topics that folks like us and many of you have been studying are going to be turbocharged by this pandemic. Everything from the way people feel about governments to how they work to how their faith plays out in everyday life. And so for all of us, I hope we take that as a bit of inspiration and a fuel to work hard. In terms of the how that we've been reacting and doing things in the moment, internationally in the beginning of March, we were all set to do a 50-country survey. Many of those countries were going to be face-to-face. And so that was our first moment where we realized, okay, something really has to give here. We were able to pivot. We will still be doing 15 countries. We will be doing them by telephone, but we had to let go of some of our plans for right now. And so reacting in the moment, I know for many of you, has been equally challenging. On the domestic front, we had a bit of an easier time methodologically. We have our American Trends panel. That's a group of 13,000 or so Americans that have been randomly selected to represent the country. And we're going to put up our methodology statement here and a link for you all to check it out. But we've been using that, and I wanted to just share a couple of the kinds of findings we've been able to produce. I think this slide is important. It shows the beginning of this crisis. It was our first survey in March, and we were asking people whether they thought there were different actions that states and the federal government were taking were necessary. And this is where you saw a nice moment of national unanimity across these different tactics, that people in general, most Republicans and Democrats, were unified. But if I show you this slide that's from a bit later, earlier in May, you can see that we still have a lot of unanimity in this country in terms of whether we see the pandemic as an economic threat. But when it comes to whether it's a healthcare threat, we're starting to see a partisan divide. And I think that that's something that other data has shown and that policymakers are grappling with, how to talk about the pandemic to these different groups. The panel, of course, because of its size, allows us to really focus in on important subgroups and the ways they may be impacted differently by the pandemic and by the recovery. We saw several examples of that early on, and we're able to bring attention to that, as many of you were. One of them is looking at the economic impact of the pandemic. You can see here in this graphic that one bar really stands out. It's the fourth one down. And it shows that 6 in 10 Hispanic Americans say that they or someone in their household has been laid off, lost a job, or taken a cut in pay. And that far exceeds other groups that we studied. If you look at healthcare impact, you see something a bit different. Here in this graphic, you can see that about a quarter of Black adults say they personally know someone who's been hospitalized or died as a result of the virus. And that is about twice as high as in the other racial and ethnic groups that we were able to study in the survey. We are also trying to remember that we are interviewing a panel. So we are talking to the same people over time. In this graphic, you can see us trying to exploit that. We interview people at a 1-month distance, and we ask them if they were experiencing any kind of psychological distress. And here's an example of where you can see the top line finding wouldn't change, that about a third were rated as high in psychological distress in 1 or both months. But if you look underneath that, you can see that some people who were not so stressed out in March had become that way in April, and vice versa. You can see how the pandemic changes things and how opinion moves. And there are so many more topics we've looked at, including some projects where we have stepped away from survey work. We're able to take advantage of some of the amazing work you all are doing in the government statistical agencies to look at jobs and other things. We're also using our data labs team to look at social media and understand how different groups of people are communicating about the virus, including members of Congress. The thing I'd like to offer you as I wrap up is that we are trying very hard, in particular right now more than ever, to make this data accessible to you as people who are interested in surveys and expert at them. I think you'll really enjoy looking at our American News Pathways tool. We had been doing a year-long project looking at how people were getting information about the national presidential election. And we, as part of that, had made an online tool where you can actually do interactive crosstabs at multiple layers online. When the pandemic came about, we were able to adapt that to include our COVID data there. So please do check it out. You can find all our data really at the point of release and look at it by all kinds of important cuts. Wrapping up, I just wanted to say that from all of us in all our basements and attics and crowded apartments to all of you, we hope that this finds you healthy. We hope that, like us, you're finding some comfort in doing meaningful work during these times. And I personally very much hope to see you all live in person next year.